Hey, Paul here, Smart Financial, back with another part of the new tax bill. Lower income people are going to hate this tax bill, actually, and I'm sad to say this is not a political statement, but I've done a few videos. You know, we broke this whole series up into 3 or 4 because just like the books that I wrote about money, it's just way too much to get 900 pages of information into one long, drawn-out, boring video. But at any rate, affluent people are going to love this tax bill. It's perfect, right? Middle income people are going to like it. There's some good things in there from 2026 to 2028. However, if you've got low income people in your family, and especially if you have senior citizens in your family that are on Medicare, Medicaid, what we call dual eligible people, I need to give you some pointers on how you can help them and how you can actually prepare yourself to take on some of the challenges with this. So number one, of the people that are saving money, upper income people are saving about 2.6%. Their tax bill is crammed down from 39% to 37%. It went from 39.6 to 37. So the average millionaire saves, say $26,000, 2.6%. The average middle class person is saving about 1.8% or about $1,400 a year. A lower income person, these are people with income between $18,000 and $53,000, they get basically a $30 increase or 0.1%. It's almost insignificant because taxes are not their issue. If you're a low income person, taxes are not the issue, folks. It's Medicare, Medicaid, and food stamps, which we now call SNAP. So let's kind of go through what's going on here. They passed this bill. We wrote a big check to pass it. We borrowed essentially $2.9 trillion that we're adding to the debt. Okay, that's just factual. That's what's going to happen here. If you follow Ray Dalio, the famous financial hedge manager and writer, he has concluded that this is the bill that tips us over from being a productive, sort of defense-oriented economy and nation to a debtor nation, because we will now be spending more on our national debt interest than on defense. And it's just like in your house. If you're spending more on interest for your credit cards and the things that you owe, and you can't afford your defense, that means premiums for your fire insurance, your health insurance, your car insurance, right? You've tipped the scales, and now you are in danger because you're not paying for the defensive things because you have to pay the folks you own money. That's where we are in the United States now. So, okay, it's just a fact. The average savings for people in the lower and middle income categories averages out to $560 a person, and the average savings for our highest 1% is $270,000 per person. Let me say that again. The average tax savings for higher income, the top 2%, is $270,000, and the average saving for great middle class of America is $560. That's why there's some social tension over this, okay? Now, what parts of this affect low-income people the most? Well, of course, it's the huge cut to Medicaid, AID. Now, there's 2 things that I'm always shocked about, and it's how much people in Washington confuse Medicare and Medicaid. Okay, Medicare, you qualify for by being 65 years or older, have done your 40 quarters, right? And you're able to collect Medicare, which is a government-based medical plan. You can get Social Security, which is a government-based check. Medicaid, AID, is not age-oriented. It's low-income oriented. So someone who's earning $18,000 a year is eligible, actually up to $21,000 a year, for Medicaid, AID. And the name really says it. It's aid. It's aid for paying for your medical insurance. It's aid for paying for your kids' food for school. It's aid for living, right? Now, the cuts to Medicaid are pretty dramatic. This is a 900-page bill, and I can't go into all of it, but one of the things that is going to be really difficult is that for dually eligible people who are over age 65 and on Medicare plus Medicaid, there's now a 15-page document they have to complete every year to get that benefit. I have to tell you, we've worked with seniors a lot in our lives. People don't get sharper with age. They don't find paperwork any easier with age. And unfortunately, 2 things are going to happen. Number one, these older people are going to be preyed on by folks who charge them to do the paperwork. I guarantee you there will be an industry that shows up of saying they're going to help older Americans qualify for and they're going to charge them to do paperwork, okay? Now, that's just a function of this bill. And some people will be able to do 15 pages of paperwork, but I don't know. That sounds like a lot, and it is the kind of thing that we call in business a bureaucratic disenrollment. Okay, what does that mean? That means that if you can't get through the bureaucracy, you get kicked off, right? Not because you don't qualify. It's because you can't get the paperwork done, okay? The second thing is they put a work requirement in of 80 hours a month, 20 hours a week. Now, I've met a lot of people on Medicaid over the years. I have to tell you, I know there's probably cheaters and fakers and liars and all that stuff, but, you know, a lot of people want to work and they can't work because people that are on Medicaid, AID, often have mental or physical problems that prevent them from working, and that's how they qualify, right? So Medicaid is the kind of aid that generally means you can't work. So putting in a work requirement, that's another eliminator. Now, there's 900 hospitals in America, according to the American Hospital Association, that are teetering on bankruptcy due to low budgetary requirements. That means they're not making any money, right? This is going to be a mandatory cut to their income. I do think we're going to see a lot of reduction in hospital access. Now, in addition to that, there is a mandatory law that's affected by this bill called PAYGO that was passed in 2010. And it means that if your bill adds to the deficit, they must mandatory cut 4% out of Medicare every year. Now, Medicare is what covers senior citizens. Now, Linda and I are on Medicare, and we have a lot of clientele on Medicare. Let me tell you what that means. Normally, your hospital bills and your doctor bills are paid about 85% by the Medicare Part A and B. Okay? Premium for that comes out of your Social Security, or you write a check. Well, guess what? If Medicare is being cut, two things are going to happen. Either your doctor is going to say you have to pay more money, or your hospital is going to say you have to pay more money, or they're going to increase the amount that they take out of our checks to cover Medicare. So this is a little devastating for our senior citizens. So I want to speak to anyone over 65 specifically. You need to contact your Medicare insurance representative. If you have Medicare Supplement or Medicare Advantage, you need to make sure that you have enough coverage. If the gap increases on what you owe, that means instead of, here's an example, if you don't owe $1,000 for your surgery, but now it's $1,400, right? You need to make sure that your Medicare coverage covers that. Open enrollment starts in October. Everybody can change. Our business goes through the usual annual enrollment things, but this year is not going to be usual. This is the year, if you're over age 65, you need to pay great attention to what your Medicare Supplement policy or your Medicare Advantage policy covers for what we call the gap, because there's going to be gaps. Now, I don't know how to help really poor people. I will tell you, it hasn't been a part of our financial practice, but we do work with families that have low income people in their world. And specifically, let me speak to folks that are in nursing homes. A lot of folks that are elderly go to a nursing home. My mom was in one in Massachusetts. My father was in one. And some people in those nursing homes pay the bill out of their pocket, and some go on a thing called Medicaid. My father worked hard. He had some money. So every month that they were in the nursing home, they wrote checks for many thousands of dollars to cover their bill. But most nursing homes have Medicaid patients where the federal government pays about 60% of the income that comes into the nursing home. So we have been told by local nursing homes that it is highly likely that if this bill passes, which it did, that they will experience less income. Now, it's the same in your house. Let's just talk about it. If you live on $10,000 a year, as an example, and all of a sudden your income is cut to $8,000 a year, things might change in your world. Well, that's how it's going to be for these nursing homes. If they're used to getting $10 million a year and their income drops because of Medicaid cuts to maybe $9 million a year, they're going to either change staff or, as we've been told by one nursing home here in Massachusetts, they will most likely close. I don't know where these older folks are going to go. I honestly have no answer to this. I find it a very, very puzzling and kind of upsetting thing. But the people that are going to be affected most by this, and that's why I said in my YouTube title, I think lower income people are going to hate this bill. I think affluent people are going to love this bill. And the middle class people are going to be okay with it, and they're going to like it for a few years. Unless they have older people in your family on Medicaid, and if you've got poor folks in your family, that you need to get ready to help them. I do think that those of us that have been fortunate and we've been blessed and we've made some money, I think that we will be required to reach out and help some of the folks in our family that are in that lower income category that are going to possibly lose some of their health care coverage or their nursing home coverage. It's just the facts. It's not sort of made up reality. I'm looking at $1 trillion in Medicaid cuts. You can't cut $1 trillion out of a system like Medicaid and not have some result. So the bill is passed. It's a part of our law. Now we have to learn to live with it, right? We can't complain about it. If you are a person age 65 or over, I suggest strongly that, of course, you should reach out to your accountant if you're affluent and ask about how it's going to affect you. And of course, you should reach out to your tax person if you're a middle income person. However, if you are a lower income person, I think there are some social services people that can help you. Reach out to whoever provides you your Medicare supplement or your Medicare Advantage plan to make sure that your plan is sufficient. If there are cutbacks that leave a gap, that you're covered and you don't have a problem getting the health care for yourself, getting food that you need for your children, if your SNAP benefits are cut. I do think that these are very serious topics to talk about with the folks that are in your network. I'm Paul Mauro, and this is Smart Financial. And I wish I had better news for the lower income folks, but as I said, we want to be completely sort of straight up about this. This is not political. This is all about financial planning for the 3 different categories of individuals affected by this particular bill: the affluent, the middle income, and unfortunately, the lower income people. If you want to reach out to us about how to help people in your family, there are some ways that we can help you strategize that. If you have lower income, if you have older folks that are on nursing homes, that are in Medicaid, please feel free, reach out, park a question. We'll actually make our team available to you at our cost. If you're in that lower income category, we have attorneys that you can consult with and tax professionals as well. I'm Paul Mauro, and staying on top of how these tax changes affect your life is just part of the art of being smart.